Our next speaker will be Dr. Partha Biswas, Chairman Scientific Committee, All India Ophthalmic Society. And he will be speaking on my strategy for competitive positioning. Dr. Partha Biswas needs no introduction. However, it's customary. He is the director of Netralayam and BBI Foundation in Kolkata. And he has held several posts in All India Ophthalmic Society. Dr. Partha Biswas, sir.
Thank you very much, Satyajit. And I hope all of you are well settled in this beautiful, beautiful location, in the beautiful conference venue which the LOC has given us. There are going to be many glitches. There are going to be many hardships. The blame has to be taken by someone. I have to take the blame for anything that goes wrong. The whole team, scientific committee team, the LOC team, and everyone has worked extremely hard to bring about a scientific program that you're going to have for the next 4 days. Anything going wrong, please call, and we'll try our best to sort it out for you. What a difficult subject Dr. Chitra has given me. My strategy for competitive positioning. I grew up as a very small practitioner. I grew up in my first days were in a very beautiful place called Virayatan, Rajgiri. Beautiful hills all around and a 100-bedded eye hospital in a garden of roses. That, I think, was the biggest turn for a competitive positioning. How many of you have a garden of roses in a 100-bedded eye hospital? So this, I think, should be one thought, that what can I give extra to my patient that the others cannot provide. So this, but again, the positioning was made alive when I went to Aravind Eye Hospital in Madurai, and I could understand that why Aravind is Aravind, why other hospitals do not have the same amount of huge sense of the foresight as Aravind. And I spent for that tenure 3 months. And in those 3 months, my whole thought process went back, turned 360 degrees, and when I came back to Rajgiri, everything that I think I could have changed, I did change. And it was a very, very supportive team that we had in the administration, and I could do so many things and make a profit of where we had a total charitable eye hospital. So what are we positioning us for? So we have to think of every element where you can give to the community what they require. What is the position is what is determined by where you are, whom you're treating, and how you're approaching. What are you targeting? All these things are all there in the back of our minds as practitioners, but we never realize it. So the market analysis, as when it comes on to the view and perception of hospital administrators, it can be very different. If it is a hospital administrator with a medical background, and if it is a hospital administrator with a non-medical background. And there is a big difference. And there comes in tussles of thought processes, what a doctor thinks his hospital should be and what an administrator thinks his hospital should be. So, but a market analysis is important, and where these two can come in is this front. A doctor must realize the treating of iritis or cataract is not the only motto for the growth of the hospital. And the administrator should also realize that it is fulfilling that need of the patient, right from the mental to the psychological to the impact that a doctor can give, is most important. And if these two things can come in, that hospital is going to flourish. There's always fulfillment of need. They have to be lacunae. These have to be taken up. And what Satyajit said and what Arvind said very correctly, that you have to take it up in that strategy, you have to take it up in that concept. Because for every hospital, there's a scope for improvement. Patient presentation, every hospital would have different sets of patients who would be presenting. If you want to make it a referral hospital, it has to have that edge over the other hospitals which are there. So that is how you have to locate it, and that is how you have to charge, and that is how the potential also should be. The location is very important. If you want your hospital to flourish, it has to be in a location where it is accessible. If you have a large volume of rural or semi-urban patients, you have to locate it near a bus stand or near the railway station. And that is how one big hospital, one big chain of hospital in Calcutta has located. It is Disha. Dr. Devashish Bhattacharya always will pick a location which is either next to the railway station or next to a large bus stand, because he caters to that population which need this transport facility, and that's how it is. Charges. Every hospital should have its own thought process on the charges. It is not that you're just plummeting down your charge just because the neighboring hospital has X amount of charge and you're charging X by 2. That is not the rule. X by 2 for the car, the class which comes in by car, would mean kuch gadbad hai. There's something wrong in that X by 2 fees. Why X by 2? That's also a swanky place. This one is also. But why are they taking X by 2? So the thought process has to be there. That is not competitive strategy. So the charges have to be such that it is a dignified charge for the dignity of that patient. Now look at this. So the optometrist thinks, optimist thinks the glass is half full, the pessimist half empty, and of course the marketing consultant will tell you the glass needs resizing. So that's how things are. We doctors don't understand too much of this, but we need to. So patient requirement, a patient analysis is important. Patient expectation, as was very correctly said by Dr. Rupal, the washrooms, that is one very important aspect, that a patient says ki that place has a good washroom. It has nothing to do with the boss who is doing a femtosecond cataract surgery, but it has everything to do with the satisfaction of that patient. He will talk about the washroom, but he'll not talk about how good my 6/6 vision is. So, you know, this is the patient's perception. We have to think from the mind of the patient. Affordability is very important. I'm sure Arvind wouldn't like to place a femtosecond laser in Theni, but he would do it he has done it in Madurai and in Pondicherry and Coimbatore. So the affordability of the class that you're wanting to treat should be very, very much attuned to what you're going to spend. At times, we as doctors, we dream, yes, I have to be Kumar doctor. I have to have this and that and everything. But Kumar doctor is in that position, in that location. Not all of us can do, even though we might have that wealth, because that femtosecond laser machine must earn for itself. The requirements of the patient for medical environment treatment, customer interface, this we don't understand so much, but expectations of patients, very important. Getting an ease of appointment, and therefore the importance of the website is so important. Getting an appointment at any time of the day or night through the website is very important. Greeting. One thing that we understood is that a patient needs that attention. Let us remember a hall packed with patient, and the doctor is doing a very fast job. He's a very busy practitioner, that's a very busy hospital, but every patient is getting fidgety. When is my time going to come? I've been here for 2 hours and 3 hours. Very, very normal conversation that goes on. And then someone says, I have a small baby at home and I don't have any more time. I have to have my refund. Immediately, there's a rush and the executives come in, the doctor comes in, sorry sir, we'll just take you in. But why did that situation arise? It just arose because the front desk of the operation or the ease of navigating patients was not there. So hygiene, waiting time, waiting area, approachability. People will wait 2 hours, will not wait 2 hours, will be actually seen by the optometrist, and then Shermas would be done, and then biometry would be done, and everything would be done, and there would be all investigations in place. But they'll say, I have had to wait 2 hours to come into your chamber. So the coming into the chamber is the main objective. But when the optometrist is seeing the patient, he has to say, I'm going to do so many tests for you. I'm going to do a slit line examination. I'm going to do a Shermas and this and that. And then we will dilate, and then doctor will see you at this time. If he understands that, then he is comfortably waiting for the surgeon to give that 5 minutes of time of that 2 hours of the waiting period. Patient's affordability is very important. Insurance aid, the in-house investigation charges, hospital charges, doctor's charges, everything comes in when you are wanting to be competitive in your positioning. Again, the location, we have spoken about all this, the financial pinch, the round-the-clock availability, surgeries that others are not performing. That is another one aspect that definitely gives you a position and edge. If you have if you are in a district town and you're doing a great cataract practice, but your colleague from the city is coming in to give retina services, and you have a retina setup. So even if it is once a week, even if it is medical retina setup, this gives an edge. So other subspecialties have to be in link with the services that you're providing, and understanding the organization's resource base. You have to know that this is what I aim for, this much and not more, or am I aiming for growth and growth and growth and many, many hospitals. So the aim and objective of every practitioner, every hospital has to be in place. So data-driven development is one thing that we do not do, but we should do, all of us, and better patient tracking, identification of the needs, investment of the demand of driven medicine, the cost reduction, and real-time care and follow-up. Everything, if it is data-driven, you have proper statistics to tell you where you are wasting, where you're not wasting, and where you can actually save costs. Team building is another great thing. Strength and weaknesses, let us build on them. The innovation factor, do something. Just let us remember that garden of roses. You might not be able to have a garden of roses, but you can have potted plants. Even if you cannot have potted plants, you can have artificial, nice floral arrangements, and that also brings in something that is an extra thing. Competing through superior service and customer relationship, these aspects are very important. But if it is a large formula like this, the most important thing is, can't I just be nice? That is very, very important. If there is a person nice in the reception, if it is a nice optometrist, if it is a nice doctor, most of the problems get settled. Evaluation and re-evaluation, of course, these are important. Audits are very important. Complaint box, reviews, listening to patients. But what is important is improvise and improve, and be content, but never stop improving yourself. Thank you very much for your patient hearing.
Thank you so much, sir.
Chitra didn't even listen to me, and she's clapping for me.
I'm
not going to give another hall, Dr. Chitra.
No, there are certain presumptions made that some people must be giving good talks. So you clap.
She's being nice.
Dr. Partha, I had one question. You are sharing all the management points with us, but you were in Rajgir and then you built your way up. None of this so-called gyan, if you can call it, nobody gave it to you or shared it to you at that point of time. Still, you rose from where you were to where you are.
Arvind, stop. Arvind, stop. This answer I have to give, and you have to be present. 1 minute.
No, he's not had his lunch, I think.
I have not had mine. So Chitra with her whole lunch is concerned about everybody else's lunch, but Chairman Scientific Committee doesn't fall in the purview.
What is good? He's in a
Ask your
court
question.
martial mode whenever he sees me.
That's what I want you to say. This is not a court martial.
Very
They are
difficult with
both
him.
they are both batchmates from Patna Medical College Hospital. They did MBBS together.
And the moderator is also from Patna. Satyajit, ask the question.
So without all this, that knowledge that you are sharing today, you have reached the pinnacle of ophthalmology work and
No way.
professionally and socially. So what would you like to share? Of even without all those gyan, you are where you are, and now you are sharing all this.
Yeah. So this is very important. I thank Satyajit for asking this very basic question. See, I'm going to look at eye to all our youngsters over there. Nandini is already laughing and smiling because this is something that I think is the most important thing. Wherever you are, at whatever stage you are, with whatever limitations you are, you must visit some hospitals in India. One, I would say, is Aravind Eye Hospital. Any of the branches, possibly Theni would be the best for somebody who's practicing in the district. Shankar Netralaya, any of the branches, whichever you can, 1 day's observership, 2 days observership, LV Prasad Eye Hospital, RP Center, Sadhguru. These are hospitals that you must visit. There are many more, but these are hospitals at that state of mind where you're receptive. You will see so many small details that you would never have imagined. I'm going to talk about one small detail and end it here. That is, when I went to Aravind, I saw how they tied the bandages on the eye. I came back and the roll of bandage that we used to use in Viratan was cut into 3, and that same bandage roll went into 3 patients. And I deduced how much we are saving for Viratan Rajgiri. And my administrators were very happy. So, these small things you will pick up only if you see, otherwise you will not pick up. And all these hospitals are there to give you observerships. Just watch. So this itself is going to be a big learning for every one of you. All my
Thank you so much, sir. Thank you.
Thank you, Partha, for being with us in your very busy schedule.